I'm Dr. Lim Lee Guan. I'm a gastroenterologist. My practice is in Mount Elizabeth Hospital in Orchard Road. I specialize in diseases of the digestive tract, including diseases of the stomach, colon, pancreas, gallbladder, as well as liver. I also perform endoscopy, including gastroscopy, colonoscopy, as well as endoscopic ultrasound, which combines the technology of endoscopy with ultrasound, primarily in diagnosis of the conditions of the pancreas, as well as certain conditions where there is a mass under deeper layers of the wall of the digestive tract.
Dr. Lin, does Helicobacter pylori increase the risk of cancer? How do we diagnose and treat it?
Yes, Helicobacter pylori does increase the risk of stomach cancer. The diagnosis of Helicobacter pylori is divided broadly into endoscopic methods and non-endoscopic methods. So non-endoscopic methods include the urine breath test, where the patient blows into a bag, and then the bag is then sent to a machine where they read the result. Stool antigen test is also possible, where the patient collects the stool and then the result is then obtained via the stool test. There's also a blood test available, but blood test in general is not as accurate and is not a preferred method for diagnosing Helicobacter pylori. In addition, endoscopic methods will consist of a rapid urine test. Example is this, where the gastric tissue is placed into a gel and the original color is a yellow. If the gel remains yellow, that means the rapid urine test is negative. That means there's no Helicobacter pylori presence. On the other hand, if the gel turns pink after a period of time, this indicates that the rapid urine test has turned positive, and this means that the patient has Helicobacter pylori infection. Another method of diagnosing Helicobacter pylori during endoscopy is histology, where a gastric biopsy specimen is sent to the lab, where the pathologist will look under the slides and look for the bacteria. Culture of Helicobacter is also available, but this is in general a very time-consuming test. The result only come out after several weeks, and is usually utilized when patients have failed initial treatment. Culture result will then help with the adjustment of the treatment method. How is Helicobacter treated? Helicobacter pylori is usually treated with an antibiotic regime, 10 to 14 days. The regime usually consists of 2 antibiotics with a medicine to suppress acidity, such as omeprazole. Success rate of treatment varies depending on the region and the regime used, but usually is in the region of between 70 to 90% with 1 round of treatment.
How do people get hepatitis B, and what are its complications?
Hepatitis B is an infective condition. It's transmitted by body fluids. So in the Asian context, it's commonly transmitted via the vertical transmission, which means it's transmitted from the mother to the baby during the time of delivery. Other methods of transmission include during blood transfusion, tattooing, during injection using needles. Complications of hepatitis B include liver fibrosis or liver hardening, as well as liver cirrhosis, which is the end stage of liver hardening, and liver cancer. Liver cirrhosis itself can cause its own range of problems, including varices, like in this case, where the vessels in the esophagus is swollen because of the increase in the pressure in the vascular system. And then this can then cause the swollen vessels to bleed, and the patient can then vomit blood. Other situations can include fluid in the abdomen, or what we call ascites, where due to an increase in pressure and the decrease in the albumin in the blood vessels, the water can then collect in the tummy, and this causes the patient to have very swollen abdomen and swollen feet. And of course, it can also lead to confusion in the patient, what we call encephalopathy, because the liver is involved in the processing of toxins. And when the liver is not functioning well, then the toxins will affect the brain adversely, and this can cause a patient to get confused. And the most feared complication of hepatitis B or any form of a liver cirrhosis will be liver cancer. Liver cancer, if discovered early, can be treated with surgery, but if it's discovered late, then the treatment becomes more difficult.
How are patients with hepatitis B treated?
Not all patients with hepatitis B need to receive treatment. However, all patients with hepatitis B must be followed up regularly with blood tests as well as ultrasound abdomen. Some patients may need to receive drug treatment, and these patients definitely has to be followed up regularly with a specialist.
Does gastroesophageal reflux disease increase the risk of cancer, and how do we manage this condition?
Gastroesophageal reflux disease, or GERD, does increase the chance of esophageal cancer. primarily through the development of Barrett's esophagus. So 5 to 15% of the patients with GERD may develop Barrett's esophagus. Barrett's esophagus refers to a condition where you can see this tongue-like extension above the junction, and this is what we call Barrett's esophagus. Patients with Barrett's esophagus may have increased risk of getting esophageal cancer. Those with just Barrett's esophagus itself without dysplasia, the risk of getting esophageal cancer is marginal at only 0.3% per year. However, if they do develop high-grade dysplasia, then the chance of cancer increases to 6%. Having said that, it is important to reinforce that most patients with gastroesophageal reflux disease do not get esophageal cancer. Esophageal cancer is by and large still a much rarer form of cancer compared to other cancers like breast cancer and colon cancer.
How do you manage GERD?
Management of GERD is divided broadly into lifestyle changes as well as medical treatment. So lifestyle changes, of course, first of all include dietary restrictions. Dietary components that commonly trigger symptoms in GERD patients include things like spicy food, coffee, tea, alcohol, citrus fruits like lemon and orange, in some patients tomato and chocolates. So patients should take note of such food items. Of course, it doesn't mean that they have to abstain completely because everybody is different. But certainly if any of these trigger off symptoms in these patients, then they should cut down on these items. Other methods will include things like lying on the left side rather than the right side. As you can see in this diagram, if a patient lies on the right side, you can see that the gastric contents reflux more easily compared to a person lying on the left side where reflux is less likely to occur. Some patients may need to sleep with the upper body inclined because at night they may have more severe symptoms. And the other thing is to avoid heavy meals within 3 hours before bedtime. Medical treatment will then include certain drugs. Of course, you can have common over-the-counter drugs such as antacids, as well as things like alginates. Other drugs will include things like H2 receptor antagonists, as well as proton pump inhibitors. And of course, the latest drug is this family called potassium channel acid blockers or PCAB. However, you must remember that medical treatment must go in hand with lifestyle changes, and the patient should not just rely completely only on medication alone without putting in effort to make changes to their lifestyle.
Dr. Lin, if I'm discovered to have colon polyps, what should I do about it? And do they turn cancerous?
So some colon polyps may have a chance of turning cancerous if they are not removed. So when you undergo a colonoscopy, the doctor who removes the polyp will send the polyp for testing at the laboratory. Depending on the size of the polyp and the type of polyp, the doctor will then recommend when to repeat the next colonoscopy. In general, patients above 50 years old are recommended to start screening for colorectal cancer. In the United States, they have shifted the cutoff age for screening for colorectal cancer earlier to age 45. Colorectal cancer screening can be done either through stool tests, known as the stool or cord blood test, or colonoscopy. Okay, it's important to lead a healthy lifestyle and to start cancer screening at an appropriate age. For example, colorectal cancer screening should be started when you hit age 50. If you find this information useful, please don't forget to follow, like, and share.